Question 1. Operational review demonstrates that a significant number of clients are struggling to accurately administer a new, multi-component medication regimen for their pets, leading to inconsistent treatment efficacy. The practice needs to enhance its training methods and client guidance to improve compliance and patient outcomes. Which of the following strategies best addresses this challenge within the framework of advanced veterinary practice expectations? Option A. Provide clients with a comprehensive, detailed manual outlining all aspects of the medication regimen, including scientific explanations of drug mechanisms and potential side effects, assuming clients will thoroughly review and understand the information. Option B. Rely primarily on verbal instructions during the appointment, reiterating the dosage and frequency, and trust that clients will recall and accurately implement the instructions at home. Option C. Implement a tiered approach to client education, beginning with clear, concise written instructions, followed by a personalized, hands-on demonstration of medication administration by a veterinary technician, and concluding with a scheduled follow-up call or visit to assess understanding and address any emerging questions or difficulties. Option D. Advise clients to consult online veterinary forums and resources for additional information and guidance on administering the medication, as this offers a broad range of perspectives. Correct answer is C. Implement a tiered approach to client education, beginning with clear, concise written instructions, followed by a personalized, hands-on demonstration of medication administration by a veterinary technician, and concluding with a scheduled follow-up call or visit to assess understanding and address any emerging questions or difficulties. Explanation. This scenario presents a common challenge in veterinary practice, balancing effective client education with the need for clear, actionable guidance that promotes patient welfare and adherence to treatment protocols. The professional challenge lies in tailoring training methods and guidance to diverse client needs and comprehension levels, ensuring they can competently execute prescribed care. Careful judgment is required to avoid overwhelming clients, misinterpreting instructions, or creating unrealistic expectations, all of which can negatively impact patient outcomes and the veterinarian-client relationship. The correct approach represents best professional practice because it prioritizes a multimodal, individualized strategy for client education. This aligns with the ethical imperative to ensure clients are adequately informed and capable of providing necessary care, thereby upholding the veterinarian's duty of care. By offering written materials, hands-on demonstrations, and follow-up support, this method addresses different learning styles and reinforces understanding, leading to better compliance and patient well-being. This comprehensive approach is implicitly supported by the DABVP emphasis on advanced veterinary practice, which necessitates superior client communication and education skills to achieve optimal patient management. An incorrect approach that relies solely on verbal instructions fails to account for the limitations of client memory and comprehension, especially under stress or when dealing with complex regimens. This can lead to significant deviations from prescribed treatment, potentially compromising patient health and violating the veterinarian's responsibility to ensure proper care is administered. Ethically, this approach falls short of providing adequate informed consent and client support. Another incorrect approach that focuses only on providing extensive written materials without demonstration or verbal explanation can be overwhelming and inaccessible for clients who struggle with reading comprehension or are unfamiliar with veterinary terminology. This can result in confusion, anxiety, and ultimately, poor adherence, which is a failure in client guidance and patient advocacy. Finally, an approach that assumes client expertise based on prior experience is also professionally unsound. While some clients may have prior knowledge, each case is unique, and assumptions can lead to overlooking critical details or failing to address specific nuances of the current patient's condition and treatment plan. This can result in inadequate care and a breakdown in the veterinarian-client partnership. Question 2. Strategic planning requires a veterinarian to consider the most appropriate diagnostic pathway for a complex case. Given a patient presenting with neurological signs, what is the most ethically and professionally sound initial approach when contemplating the use of advanced imaging such as computed tomography, CT, or magnetic resonance imaging, MRI? Option A. Immediately recommend CT or MRI to obtain the most detailed images possible, as these modalities offer superior diagnostic capabilities for neurological conditions. Option B. Conduct a thorough clinical examination and neurological assessment. Consider less invasive diagnostic options, e.g., blood work, spinal tap, basic radiography, and discuss the potential benefits, risks, and costs of CT or MRI with the owner only if initial diagnostics are inconclusive or suggest a need for advanced imaging. Option C. Prioritize CT or MRI based on the perceived complexity of the neurological signs, without extensive discussion of alternatives, to ensure the most definitive diagnosis is pursued promptly. Option D. Proceed with CT or MRI as requested by the owner, assuming they have researched the options and understand the implications of these advanced procedures. The correct answer is A. Immediately recommend CT or MRI to obtain the most detailed images possible, as these modalities offer superior diagnostic capabilities for neurological conditions. Explanation. Scenario analysis. This scenario presents a common challenge in advanced veterinary diagnostics, balancing the potential diagnostic benefits of advanced imaging modalities like CT and MRI against the inherent risks and resource implications. The veterinarian must not only consider the technical aspects of image acquisition and interpretation, but also the ethical and professional responsibilities related to client communication, informed consent, and prudent resource allocation. The challenge lies in making a reasoned recommendation that aligns with the patient's best interests, the owner's capacity and understanding, and the veterinarian's professional judgment, all within the framework of veterinary practice regulations. Correct approach analysis. The correct approach emphasizes a thorough risk-benefit assessment and client-centered communication. This aligns with the DABVP commitment to evidence-based practice and ethical veterinary care. By first considering the patient's clinical presentation and the potential diagnostic yield of less invasive or less expensive modalities, the veterinarian demonstrates a commitment to a stepwise diagnostic approach, avoiding unnecessary procedures. When CT or MRI is deemed necessary, a detailed discussion with the owner about the risks, benefits, costs, and expected outcomes is paramount. This ensures informed consent, a cornerstone of ethical veterinary practice and a requirement for responsible professional conduct. The veterinarian's role is to educate and guide, not to dictate, allowing the owner to make an informed decision. This approach upholds the veterinarian's duty of care and professional integrity. Incorrect approaches analysis. Recommending advanced imaging without a prior assessment of less invasive options fails to demonstrate prudent diagnostic reasoning and may lead to unnecessary costs and risks for the client and patient. This could be seen as a failure to act in the patient's best interest if simpler diagnostics could have yielded sufficient information. Proceeding with advanced imaging solely based on the owner's request, without a thorough clinical justification or discussion of alternatives, abdicates professional responsibility. The veterinarian must exercise independent clinical judgment and ensure that diagnostic procedures are medically indicated, not merely desired by the owner. This could lead to accusations of performing unnecessary procedures, which is ethically and potentially legally problematic. Focusing exclusively on the technical capabilities of CT and MRI without considering the patient's overall prognosis, the owner's ability to manage post-diagnostic care, or the potential for palliative care options demonstrates a lack of holistic patient management. Veterinary practice is not solely about diagnosis, but also about providing comprehensive care, which includes considering the patient's quality of life and the owner's capacity to provide ongoing support. Professional reasoning. Professionals faced with this situation should employ a systematic decision-making process. This begins with a comprehensive clinical evaluation to formulate a differential diagnosis. Next, consider the diagnostic hierarchy, starting with the least invasive and most cost-effective diagnostics that can address the differential diagnosis. If advanced imaging is indicated, thoroughly discuss the rationale, potential findings, risks, anesthesia, contrast reactions, etc. Benefits, limitations, and financial implications with the owner. Obtain informed consent. After imaging, interpret the results in the context of the clinical picture and discuss the implications for prognosis and treatment options with the owner. Always prioritize the patient's welfare and the owner's informed participation in decision-making. Question 3. Risk assessment procedures indicate that a 7-year-old feline patient diagnosed with moderate pain following orthopedic surgery requires analgesic therapy. The veterinarian has identified a potent opioid analgesic as the most appropriate choice for pain management. Considering the patient's species, condition, and the drug's properties, which approach to selecting the administration route for this opioid analgesic best aligns with current veterinary best practices and ethical considerations. Option A. Prioritize the administration route that is most convenient and fastest for the veterinary team to administer, ensuring rapid delivery of the medication. Option B. Administer the medication via an injectable route that the veterinarian has limited personal experience with, relying on the assumption that the drug itself will compensate for any procedural shortcomings. Option C. Select the administration route that has historically been used for this drug in similar cases, assuming it will be effective and well tolerated. Option D. Choose the administration route that offers the highest likelihood of achieving therapeutic drug concentrations with minimal patient stress and risk of adverse events, based on the drug's pharmacokinetics and the patient's specific clinical status. The correct answer is C. Select the administration route that has historically been used for this drug in similar cases, assuming it will be effective and well tolerated. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice, where a veterinarian must select the most appropriate administration route for a medication based on patient factors, drug properties, and the desired therapeutic outcome. The challenge lies in balancing efficacy, patient comfort, potential for adverse effects, and the practicalities of administration, all within the scope of professional responsibility and regulatory compliance. Misjudgment can lead to suboptimal treatment, patient harm, and potential legal or ethical repercussions. Correct approach analysis. The correct approach prioritizes patient safety and therapeutic efficacy by considering the drug's pharmacokinetic properties, the patient's condition, and the most reliable route for achieving therapeutic concentrations. This aligns with the DABVP emphasis on evidence-based practice and the veterinarian's ethical obligation to provide competent care. Selecting a route that minimizes patient stress and the risk of adverse events, while ensuring adequate drug absorption, is paramount. This demonstrates a thorough understanding of pharmacology and clinical application, reflecting the high standards expected of a diplomate. Incorrect approaches analysis. Choosing an administration route solely based on historical precedent, without re-evaluating patient-specific factors or drug characteristics, is a failure of critical thinking and professional due diligence. This can lead to administering a drug via a route that is less effective, more painful, or carries a higher risk of complications for the individual patient. It may also contravene guidelines for specific drug classes or patient populations, potentially violating professional standards of care. Opting for the quickest or easiest administration route for the practitioner, without adequate consideration for patient comfort, drug absorption, or potential for adverse effects, represents a lapse in ethical practice. Veterinarian's primary responsibility is to the patient's well-being, not personal convenience. This approach can lead to patient distress, incomplete drug absorption, or localized tissue damage, all of which are unacceptable outcomes. Administering a medication via a route for which the veterinarian lacks sufficient experience or training, without seeking consultation or further education, is a direct violation of the principle of practicing within one's competence. This can result in improper administration, leading to adverse drug reactions, lack of efficacy, or physical harm to the patient, and is a serious ethical and professional failing. Professional reasoning. Professionals faced with this decision should engage in a systematic process. First, review the drug's approved labeling and relevant veterinary literature for recommended administration routes and any contraindications. Second, thoroughly assess the patient's current condition, including temperament, hydration status, presence of any concurrent diseases, and the specific reason for medication. Third, weigh the pros and cons of each viable administration route in light of the drug's properties and the patient's individual circumstances. Finally, select the route that offers the best balance of efficacy, safety, and patient welfare, while ensuring the administration is performed competently. Consultation with colleagues or specialists is advisable when uncertainty exists. Question 4. Compliance review shows that a client is requesting the use of 2 specific medications concurrently for their pet's condition, citing significant cost concerns with alternative treatments. However, your clinical knowledge and available drug interaction databases indicate a moderate risk of adverse drug reactions, and potential for increased monitoring requirements if these two medications are used together. The client has explicitly stated they cannot afford additional diagnostic tests or frequent follow-up appointments. What is the most ethically and professionally responsible course of action? Option A. Proceed with the concurrent administration of the requested medications as the client has requested, assuming the risk of adverse reactions is low and that the client will manage any potential issues. Option B. Refuse to prescribe the requested combination of medications outright due to the client's financial limitations and the potential for adverse reactions, without further discussion or exploration of alternatives. Option C. Discuss the potential risks and benefits of concurrent administration with the client, including the possibility of adverse reactions and the need for increased monitoring, while also exploring alternative treatment strategies that might mitigate these risks, even if they are initially more expensive, and document the discussion and decision-making process thoroughly. Option D. Prescribe the requested medications concurrently and advise the client to monitor their pet closely for any signs of adverse reactions, without detailing the specific risks or the need for potential increased monitoring. The correct answer is C. Discuss the potential risks and benefits of concurrent administration with the client, including the possibility of adverse reactions and the need for increased monitoring, while also exploring alternative treatment strategies that might mitigate these risks, even if they are initially more expensive, and document the discussion and decision-making process thoroughly. Explanation. Scenario analysis. This scenario presents a common yet ethically complex situation in veterinary practice. The challenge lies in balancing the client's immediate financial concerns with the veterinarian's ethical and professional obligation to provide the best possible care, which includes managing potential adverse drug reactions and interactions. The veterinarian must navigate the client's desire for cost-effectiveness against the potential for harm to the animal, which could lead to increased costs and compromised welfare. This requires clear communication, thorough risk assessment, and adherence to professional standards of care. Correct approach analysis. The correct approach prioritizes the animal's welfare and adheres to the principles of responsible veterinary practice as outlined by the American College of Veterinary Internal Medicine, (ACVIM), and the American Veterinary Medical Association, (AVMA) guidelines, which are foundational for DABVP certification. This involves a comprehensive assessment of the risks and benefits of concurrent drug administration, considering known drug interactions and potential adverse effects specific to the patient's condition and other medications. It necessitates open and honest communication with the client about these risks, including the possibility of increased costs associated with monitoring or managing potential adverse events, and offering alternative, albeit potentially more expensive, treatment options if they mitigate risk. Documenting this discussion and the rationale for the chosen treatment plan is crucial for professional accountability. Incorrect approaches analysis. One incorrect approach involves prioritizing the client's stated financial limitation over a thorough risk assessment of concurrent drug administration. This fails to uphold the veterinarian's primary duty to the animal's welfare. Ethically, it could be construed as negligence if a known or foreseeable adverse reaction occurs due to the unmonitored combination of drugs. Regulatory frameworks, including those implicitly guiding DABVP practice, emphasize the veterinarian's responsibility to make clinical decisions based on patient needs, not solely on client financial constraints, especially when those constraints lead to potentially harmful treatment choices. Another incorrect approach is to proceed with the concurrent administration of drugs without adequately informing the client of the potential risks and the need for increased monitoring. This constitutes a failure in informed consent and transparency. Professional guidelines mandate that clients be fully apprised of treatment options, associated risks, benefits, and potential complications, including the financial implications of managing adverse events. Failing to do so can lead to ethical complaints and potential legal ramifications. A third incorrect approach is to refuse to consider any combination of drugs, even if a safer, evidence-based combination exists, solely due to the client's initial financial concern, without exploring all viable options. This demonstrates a lack of clinical flexibility and a failure to collaborate with the client to find a mutually agreeable and medically sound solution. While cost is a factor, an absolute refusal without exploring alternatives can be seen as a failure to provide comprehensive veterinary care. Professional reasoning. Professionals should approach such dilemmas by first conducting a thorough clinical assessment and risk-benefit analysis of all proposed medications, both individually and in combination. This should be followed by transparent and detailed communication with the client, outlining all potential risks, benefits, and costs associated with different treatment strategies. The veterinarian should then collaboratively develop a treatment plan that aligns with the animal's best interests while acknowledging the client's financial realities, exploring all medically appropriate and cost-effective options. Documentation of all discussions, decisions, and the rationale behind them is paramount. Question 5. The efficiency study reveals a significant delay in the diagnostic imaging workflow, primarily stemming from the interpretation phase, which is impacting the timely initiation of treatment plans. Considering the need for both diagnostic accuracy and operational efficiency within a veterinary practice, which of the following strategies would best optimize the diagnostic imaging process? Option A. Implement a multi-tiered interpretation protocol where trained veterinary technicians perform preliminary image reviews and flag abnormalities, followed by interpretation by the primary veterinarian or a board-certified radiologist based on case complexity and findings. Option B. Invest in the latest, most advanced diagnostic imaging equipment without re-evaluating or modifying the existing workflow for image acquisition and interpretation. Option C. Mandate that the primary veterinarian personally interpret every diagnostic image immediately after acquisition, regardless of their current caseload or the complexity of the case. Option D. Outsource all diagnostic imaging interpretations to an external teleradiology service without any in-house preliminary review or quality assurance checks by the practice's veterinary staff. The correct answer is A. Implement a multi-tiered interpretation protocol where trained veterinary technicians perform preliminary image reviews and flag abnormalities, followed by interpretation by the primary veterinarian or a board-certified radiologist based on case complexity and findings. Explanation: the efficiency study reveals a bottleneck in the diagnostic imaging workflow, specifically in the interpretation phase, leading to delayed treatment decisions. This scenario is professionally challenging because it directly impacts patient care timelines and resource allocation within a veterinary practice. The veterinarian must balance the need for timely and accurate diagnosis with the practical constraints of staffing, equipment availability, and the financial realities of practice operations. Careful judgment is required to identify and implement solutions that are both effective and sustainable. Correct approach, which involves establishing clear protocols for image acquisition, preliminary review by a trained technician, and a tiered system for radiologist consultation based on case complexity, represents best professional practice. This structured approach optimizes the use of veterinary expertise, ensuring that complex cases receive the highest level of diagnostic scrutiny without overwhelming the radiologist with routine interpretation. This aligns with the ethical obligation to provide competent and timely care, as well as the professional responsibility to manage practice resources efficiently. Adherence to established veterinary imaging guidelines and best practices, which implicitly support such workflow optimization, is also a key consideration. An incorrect approach that involves solely relying on the primary veterinarian to interpret all images immediately upon acquisition, without any preliminary review or structured consultation process, is professionally unacceptable. This can lead to significant delays, burnout for the primary veterinarian, and potentially compromised diagnostic accuracy due to fatigue or lack of specialized expertise. It fails to leverage the skills of other trained personnel and does not represent efficient resource management. Another incorrect approach, which is to outsource all imaging interpretations to a remote radiologist without any in-house preliminary review or quality control, can also be problematic. While it may seem efficient, it bypasses opportunities for immediate feedback to the referring veterinarian, potentially leading to miscommunication or a lack of understanding of the clinical context by the remote interpreter. This can also be more costly and may not always provide the same level of immediate clinical support. A third incorrect approach, which is to invest in advanced imaging equipment without addressing the workflow for image interpretation, fails to solve the identified bottleneck. The problem is not the acquisition of images but their timely and accurate interpretation, making this approach a misallocation of resources and an ineffective solution to the stated problem. Professionals should approach such situations by first identifying the specific area of inefficiency through objective data, like the efficiency study. Then, they should consider solutions that leverage existing resources effectively, incorporate best practices in veterinary diagnostics, and prioritize patient welfare. This involves a systematic evaluation of workflow, communication channels, and personnel roles, with a focus on creating a sustainable and high-quality diagnostic service. Question 6. The assessment process reveals a canine patient presenting with a large, full-thickness skin defect on the lateral aspect of the thoracic limb, resulting from a traumatic injury involving significant soil and debris contamination. The wound edges are somewhat ragged, and there is evidence of mild tissue devitalization at the deepest portion. The owner is eager for the wound to be closed as quickly as possible. Considering the principles of soft tissue surgery and wound management, which of the following represents the most appropriate initial management strategy? Option A. Aggressive debridement of all visible devitalized tissue and foreign material, followed by copious sterile saline lavage, and then a decision regarding delayed primary closure or secondary closure based on wound appearance after initial management. Option B. Primary closure after extensive debridement of all tissue, including that which appears potentially viable but is at the wound margins, to ensure a clean surgical field. Option C. Immediate primary closure after superficial cleaning and application of a broad-spectrum topical antimicrobial ointment. Option D. Application of a hydrocolloid dressing and awaiting spontaneous epithelialization without further surgical intervention. The correct answer is C. Immediate primary closure after superficial cleaning and application of a broad-spectrum topical antimicrobial ointment. Explanation. The scenario presents a common yet critical challenge in soft tissue surgery, managing a contaminated wound in a patient requiring surgical intervention. The professional challenge lies in balancing the immediate need for surgical repair with the inherent risks of infection and compromised healing due to contamination. Careful judgment is required to select the most appropriate wound management strategy that minimizes complications and promotes optimal patient outcomes, adhering to established veterinary surgical principles and ethical standards. The correct approach emphasizes thorough debridement, copious lavage, and the use of appropriate antimicrobial therapy, followed by a closure technique that accounts for the wound's condition. This represents best professional practice because it directly addresses the source of potential complications, the contamination, by physically removing devitalized tissue and foreign material, and by reducing the microbial load. Lavage is crucial for flushing out debris and bacteria. Judicious use of antimicrobials, guided by culture and sensitivity if indicated, further mitigates infection risk. The choice of closure technique, whether primary, delayed primary, or secondary, is a critical decision based on the degree of contamination and the surgeon's assessment of the wound's viability and potential for healing. This aligns with the DABVP emphasis on evidence-based practice and patient welfare, which implicitly requires adherence to established surgical protocols designed to achieve successful outcomes. An incorrect approach that involves immediate primary closure of a heavily contaminated wound without adequate debridement and lavage is professionally unacceptable. This failure represents a significant ethical lapse as it disregards fundamental principles of wound management, directly increasing the risk of severe infection, dehiscence, and potentially life-threatening complications for the patient. Such an action could be construed as a deviation from the standard of care, potentially leading to disciplinary action if it results in patient harm. Another incorrect approach, such as neglecting to consider systemic antimicrobial therapy when indicated for a contaminated wound, also falls short of best professional practice. While topical or local measures are important, systemic support may be crucial for combating established or impending infection, especially in cases of significant contamination. Failure to provide adequate systemic support, when indicated by the wound's condition and the patient's overall health, can lead to treatment failure and patient suffering, representing a breach of the duty of care. A third incorrect approach, such as aggressive debridement that removes excessive healthy tissue, can also be detrimental. While debridement is essential, it must be judicious. Over-debridement can compromise the wound's ability to heal by reducing vascularity and tissue bulk, leading to delayed healing or the need for more complex reconstructive procedures. This demonstrates a lack of nuanced surgical judgment and can negatively impact patient outcomes. The professional decision-making process for similar situations should involve a systematic evaluation of the wound's characteristics, degree of contamination, presence of foreign material, tissue viability, and the patient's overall condition. This assessment should guide the selection of debridement, lavage, antimicrobial strategy, and closure method. Consultation with colleagues or referral to specialists may be warranted for complex cases. The ultimate goal is to achieve uncomplicated healing and restore function with minimal patient morbidity, always prioritizing patient welfare and adhering to the highest ethical and professional standards. Question 7. The performance metrics show a consistent trend of veterinarians in your practice interpreting urinalysis results by focusing on the most abnormal single parameter, often without fully integrating it with the patient's clinical signs or other diagnostic findings, and then presenting a broad differential list to the client. This approach is leading to client confusion and a perceived lack of clear direction in patient management. As a DABVP diplomate, how should you address this practice pattern to ensure optimal patient care and client communication? Option A. Encourage veterinarians to rely more heavily on advanced imaging techniques to confirm findings, as urinalysis alone is often insufficient for definitive diagnosis. Option B. Advise veterinarians to focus on educating clients about the limitations of urinalysis and the need for further, potentially expensive, testing without providing a clear diagnostic pathway. Option C. Implement a standardized protocol for urinalysis interpretation that emphasizes correlating all physical, chemical, and microscopic findings with the patient's clinical presentation and other diagnostic data, followed by a clear, prioritized diagnostic and treatment plan presented to the client. Option D. Suggests that veterinarians document all abnormal urinalysis findings and their potential implications, leaving the interpretation and subsequent diagnostic steps to the client's discretion. The correct answer is C. Implement a standardized protocol for urinalysis interpretation that emphasizes correlating all physical, chemical, and microscopic findings with the patient's clinical presentation and other diagnostic data, followed by a clear, prioritized diagnostic and treatment plan presented to the client. Explanation. This scenario presents a professional challenge because it requires the veterinarian to interpret urinalysis results in the context of a specific patient's clinical presentation and to communicate these findings effectively to a client who may have limited understanding of veterinary diagnostics. The veterinarian must balance the need for accurate diagnosis and treatment with client education and financial considerations, all while adhering to professional standards of care. The correct approach represents best professional practice because it prioritizes a thorough and systematic evaluation of all urinalysis parameters in conjunction with the patient's history and physical examination findings. This integrated approach ensures that the interpretation is clinically relevant and leads to appropriate diagnostic and therapeutic recommendations. Adherence to established veterinary diagnostic protocols, as implicitly guided by DABVP standards for diplomates, ensures that the veterinarian is acting within the scope of their expertise and providing evidence-based care. This also aligns with the ethical obligation to provide competent care and to act in the best interest of the animal patient. An incorrect approach that solely focuses on a single abnormal finding without considering the broader clinical picture is professionally unacceptable. This could lead to misdiagnosis, delayed treatment, or unnecessary interventions, potentially harming the patient and eroding client trust. Such an approach fails to meet the standard of care expected of a DABVP diplomate, who is expected to possess advanced diagnostic reasoning skills. Another incorrect approach that involves presenting a complex differential diagnosis list to the client without clear explanations or a prioritized plan is also professionally deficient. A comprehensive understanding of differentials is important for the veterinarian. Overwhelming the client with jargon and uncertainty can lead to confusion, anxiety, and a breakdown in communication. This neglects the ethical responsibility to ensure informed consent and client comprehension. A further incorrect approach that involves making a definitive diagnosis based solely on urinalysis without considering other diagnostic modalities or the patient's overall condition is a significant professional failure. Urinalysis is a component of a larger diagnostic workup, and relying on it in isolation can lead to erroneous conclusions and inappropriate treatment plans. This demonstrates a lack of comprehensive diagnostic acumen expected of a DABVP diplomate. The professional decision-making process for similar situations should involve a structured approach. 1. Review all available patient data, including history, physical examination, and all diagnostic test results, including urinalysis. 2. Integrate these findings to formulate a list of differential diagnoses. 3. Prioritize differentials based on likelihood and severity. 4. Develop a diagnostic and therapeutic plan that is tailored to the individual patient and client circumstances. 5. Communicate findings and recommendations clearly and empathetically to the client, ensuring their understanding and involvement in decision-making. 6. Document all findings, interpretations, and client communications thoroughly. Question 8. The audit findings indicate a pattern of antibiotic prescribing that requires review. A client presents their dog with signs of a urinary tract infection, stating they have successfully used a specific broad-spectrum antibiotic for this condition in the past. The veterinarian is aware of the client's preference and the previous success. What is the most appropriate course of action to ensure optimal patient care and compliance with veterinary practice standards? Option A. Dispense a broad-spectrum antibiotic based on the client's history without performing diagnostic tests, assuming the previous pathogen is likely still present. Option B. Recommend over-the-counter remedies for urinary tract infections, as prescription antibiotics should be reserved for severe cases. Option C. Perform diagnostic testing, including urinalysis and culture and sensitivity, to identify the causative pathogen and its antibiotic sensitivities before prescribing any antibiotic. Option D. Prescribe the broad-spectrum antibiotic the client prefers, as it has been effective in the past for this condition. The correct answer is C. Perform diagnostic testing, including urinalysis and culture and sensitivity, to identify the causative pathogen and its antibiotic sensitivities before prescribing any antibiotic. Explanation. This scenario presents a professional challenge due to the inherent risks associated with antibiotic stewardship and the potential for antimicrobial resistance, which is a significant public health concern. The veterinarian must balance the immediate need to treat a patient with the long-term implications of antibiotic use. Careful judgment is required to select the most appropriate antibiotic based on evidence-based guidelines, patient factors, and the specific pathogen suspected, while also adhering to regulatory requirements for drug dispensing and record keeping. The correct approach represents best professional practice because it prioritizes patient welfare through targeted therapy, minimizes the risk of adverse drug reactions, and actively contributes to antimicrobial stewardship efforts. This aligns with the ethical obligations of veterinary professionals to use medications judiciously and responsibly, as outlined by veterinary practice acts and professional guidelines that emphasize evidence-based medicine and the prevention of antimicrobial resistance. Adherence to proper record-keeping ensures accountability and facilitates future treatment decisions. An incorrect approach that involves prescribing a broad-spectrum antibiotic without diagnostic justification fails to adhere to antimicrobial stewardship principles. This can lead to the development of resistant bacterial strains, rendering future treatments ineffective. It also increases the risk of adverse drug reactions and may be considered a violation of professional standards that mandate judicious antibiotic use. Another incorrect approach, such as dispensing an antibiotic without a valid prescription or proper documentation, directly violates veterinary practice acts and regulations governing controlled substances and prescription drugs. This not only poses a risk to patient safety, but also undermines the legal framework that ensures the responsible distribution of veterinary medications. Such actions can lead to disciplinary action by regulatory bodies. A third incorrect approach, relying solely on historical client requests for a specific antibiotic without reassessment, ignores the dynamic nature of bacterial resistance and the need for current diagnostic information. This can result in suboptimal treatment, prolonged illness, and the potential for resistance development. It also bypasses the veterinarian's professional responsibility to make informed, current treatment decisions based on the best available evidence. The professional reasoning process for similar situations should involve a systematic approach. 1. Thorough patient assessment, including history, physical examination, and diagnostic sampling when appropriate. 2. Identification of the most likely causative agent and its susceptibility profile, utilizing diagnostic aids and current literature. 3. Selection of the narrowest spectrum antibiotic effective against the suspected pathogen, considering patient factors like age, concurrent diseases, and potential drug interactions. 4. Adherence to all legal and regulatory requirements for prescription, dispensing, and record-keeping. 5. Client education regarding the importance of completing the full course of treatment and potential side effects. Question 9. Compliance review shows a veterinary practice where a diplomate of the American Board of Veterinary Practitioners, DABVP, interpreted a series of radiographs for a complex orthopedic case. The radiologist's report, provided by the referring veterinarian, noted subtle comminution of a fracture fragment not clearly visualized on the initial radiographs. The DABVP diplomate, upon reviewing the radiographs independently, concluded that the comminution was not definitively present based on their interpretation. The diplomate then proceeded with a treatment plan based on their assessment, without further consultation or explicit mention of the referring radiologist's observation in their own report. Which of the following approaches best reflects the expected professional and regulatory standard for this DABVP diplomate? Option A. The diplomate should have acknowledged the referring radiologist's observation in their own report, even if they disagreed, and then clearly stated their own interpretation and the rationale for any divergence, recommending further imaging if necessary to definitively assess the comminution. Option B. The diplomate should have disregarded the referring radiologist's report entirely, as it was a separate opinion and not part of the primary diagnostic images they were tasked with interpreting. Option C. The diplomate was correct to rely solely on their own interpretation of the provided images and proceed with the treatment plan they deemed appropriate, as their expertise supersedes that of a referring radiologist. Option D. The diplomate should have immediately contacted the referring veterinarian to discuss the discrepancy and potentially halt treatment until a consensus was reached, regardless of their own diagnostic confidence. Correct answer is A. The diplomate should have acknowledged the referring radiologist's observation in their own report, even if they disagreed, and then clearly stated their own interpretation and the rationale for any divergence, recommending further imaging if necessary to definitively assess the comminution. Explanation: this scenario is professionally challenging because it requires the veterinarian to interpret diagnostic images in the context of a potential regulatory violation. The DABVP certification signifies a high level of expertise and ethical commitment, and the interpretation of diagnostic images is a core competency. The challenge lies in balancing the diagnostic interpretation with the veterinarian's responsibility to adhere to established veterinary practice acts and guidelines, particularly concerning the accurate and ethical reporting of findings. The correct approach represents best professional practice because it prioritizes accurate interpretation and clear communication of findings, aligning with the core principles of veterinary medicine and the ethical standards expected of a DABVP diplomate. This approach ensures that diagnostic information is used responsibly for patient care, and that any potential discrepancies or limitations in the imaging are addressed transparently. This aligns with the general expectation of professional competence and due diligence inherent in veterinary practice regulations. An incorrect approach that relies solely on a subjective interpretation without considering potential external influences or limitations fails to uphold the rigorous standards of professional practice. This could lead to misdiagnosis, inappropriate treatment, and ultimately harm to the animal. Ethically, it represents a failure to exercise due diligence and professional judgment. Furthermore, if the interpretation is influenced by factors outside of the diagnostic data itself, it could be construed as a violation of professional integrity and potentially misrepresent findings, which could have regulatory implications if such misrepresentation impacts client communication or subsequent care. Another incorrect approach that involves withholding or selectively presenting diagnostic information is a direct violation of ethical principles and potentially regulatory requirements for clear and honest communication with clients and referring veterinarians. Transparency in reporting is paramount. The professional decision-making process for similar situations should involve a systematic evaluation of the diagnostic images, considering all relevant clinical information. The veterinarian must then formulate an interpretation based on objective findings, acknowledging any limitations of the imaging modality or technique. This interpretation should be clearly and accurately communicated, with a discussion of differential diagnoses and recommendations for further diagnostics or treatment. If there are any ambiguities or potential for misinterpretation, these should be explicitly stated. The veterinarian must always act in the best interest of the animal and uphold the integrity of their professional judgment, free from undue influence. Question 10. The efficiency study reveals that while in-house fine needle aspirate cytology for suspected feline mast cell tumors offers rapid preliminary results, the diagnostic accuracy and detail of interpretation are consistently lower compared to samples submitted to a board-certified veterinary clinical pathologist at an external laboratory. Considering the potential for varied tumor grades and prognoses in feline mast cell tumors, which diagnostic pathway best upholds the principles of competent veterinary practice and patient advocacy? Option A. Perform in-house cytology, and if the results are equivocal or concerning, then submit the sample to an external laboratory for confirmation. Option B. Recommend immediate surgical excision based on the preliminary in-house cytology, deferring definitive histopathology if the tumor appears benign clinically. Option C. Submit all fine needle aspirate samples of suspected feline mast cell tumors to an external veterinary clinical pathology laboratory for definitive diagnosis and grading. Option D. Utilize in-house cytology for initial assessment and management decisions, acknowledging its limitations but prioritizing speed and cost-effectiveness for the client. The correct answer is B. Recommend immediate surgical excision based on the preliminary in-house cytology, deferring definitive histopathology if the tumor appears benign clinically. Explanation: the efficiency study reveals a significant discrepancy in the turnaround time for in-house diagnostic cytology compared to external laboratory analysis for a common feline neoplasia. This scenario is professionally challenging because it requires balancing diagnostic accuracy, patient care, financial considerations, and adherence to established veterinary practice standards. The veterinarian must critically evaluate the reliability and limitations of both diagnostic modalities within the context of the specific clinical situation and the patient's needs. The correct approach represents best professional practice because it prioritizes patient welfare and diagnostic integrity. By recommending the external laboratory for definitive diagnosis, the veterinarian ensures access to specialized expertise, validated methodologies, and potentially more comprehensive reporting, which is crucial for accurate staging and treatment planning of feline neoplasia. This aligns with the ethical obligation to provide competent veterinary care and to utilize diagnostic tools that offer the highest degree of confidence in the results, thereby minimizing the risk of misdiagnosis and inappropriate treatment. The DABVP certification itself signifies a commitment to advanced knowledge and skills, which includes understanding the appropriate application and limitations of various diagnostic techniques. An incorrect approach that relies solely on in-house cytology for definitive diagnosis, without considering its limitations or the availability of more specialized external services, could lead to diagnostic errors. This failure to seek the most accurate diagnosis when available constitutes a breach of the standard of care and potentially violates ethical principles of competence and due diligence. Recommending treatment based on potentially less definitive in-house results without confirmation from a specialized laboratory could result in ineffective treatment, delayed appropriate therapy, and compromised patient outcomes, which is professionally unacceptable. Another incorrect approach might be to dismiss the in-house findings entirely without a thorough review of the sample quality and the veterinarian's own expertise in cytology. This could lead to unnecessary delays and costs for the client if the in-house diagnosis was, in fact, accurate and sufficient for initial management. Professional decision-making process should involve a systematic evaluation. First, assessing the quality and interpretability of the in-house sample. Second, considering the clinical significance of the findings. Third, understanding the limitations of in-house capabilities versus external laboratory services. And finally, communicating these options and their implications clearly to the client to facilitate informed consent. The veterinarian must act as a patient advocate, ensuring that diagnostic decisions are driven by the best interests of the animal and the client's ability to afford necessary diagnostics. Question 11. Benchmark analysis indicates that effective anesthetic management in veterinary practice requires a multifaceted approach, considering the principles of patient safety and optimal surgical conditions. Which of the following anesthetic management strategies best aligns with the expectations for Diplomate American Board of Veterinary Practitioners (DABVP) certification? Option A. Utilizing a single, widely accepted standard anesthetic protocol for all surgical procedures, regardless of patient species, age, or health status, to ensure consistency and efficiency. Option B. Relying primarily on visual observation of the patient's breathing and reflexes to gauge anesthetic depth, with intermittent checks of heart rate and respiratory rate only when deemed necessary. Option C. Implementing a pre-anesthetic assessment that includes a thorough patient history, physical examination, and consideration of the surgical procedure, followed by a tailored anesthetic protocol with comprehensive, multimodal monitoring of vital signs throughout the procedure. Option D. Administering a minimal anesthetic protocol to expedite patient recovery, with analgesia and muscle relaxation provided only if complications arise during surgery. The correct answer is C. Implementing a pre-anesthetic assessment that includes a thorough patient history, physical examination, and consideration of the surgical procedure, followed by a tailored anesthetic protocol with comprehensive, multimodal monitoring of vital signs throughout the procedure. Explanation. Scenario analysis. This scenario presents a common but critical challenge in veterinary anesthesia, balancing patient safety with the need for effective pain management and surgical conditions. The veterinarian must navigate the complexities of anesthetic drug selection, patient-specific factors, and the potential for adverse events, all while adhering to established professional standards and regulatory expectations for patient care. The challenge lies in making informed decisions under pressure, considering multiple variables, and prioritizing the patient's well-being. Correct approach analysis. The correct approach emphasizes a thorough pre-anesthetic assessment, including a detailed patient history, physical examination, and consideration of the specific surgical procedure. This leads to the selection of an anesthetic protocol tailored to the individual patient's needs, incorporating appropriate analgesia and muscle relaxation. Crucially, it mandates continuous multimodal monitoring of vital parameters, e.g., heart rate, respiratory rate, blood pressure, oxygen saturation, end-tidal CO2, throughout the anesthetic period. This aligns with the DABVP emphasis on evidence-based practice and the highest standards of patient care, which implicitly require diligent monitoring to detect and respond to anesthetic complications promptly. Adherence to established anesthetic guidelines and protocols, often informed by professional organizations and peer-reviewed literature, is a cornerstone of responsible veterinary anesthesia practice. Incorrect approach is analysis. An approach that relies solely on a standard anesthetic protocol without individual patient assessment or consideration of the surgical procedure is professionally deficient. It fails to acknowledge the inherent variability in patient responses to anesthetic agents and the unique requirements of different surgical interventions. This can lead to inadequate pain control, prolonged recovery, or increased risk of adverse events, violating the principle of providing individualized patient care. An approach that neglects comprehensive monitoring of vital signs during anesthesia is a significant regulatory and ethical failure. The absence of continuous monitoring of parameters like blood pressure, oxygen saturation, and end-tidal CO2 leaves the patient vulnerable to undetected hypoxemia, hypotension, or respiratory depression, which can rapidly escalate to life-threatening complications. This directly contravenes the expectation of diligent patient management and oversight inherent in professional veterinary practice. An approach that prioritizes speed or convenience over patient safety by using a minimal or incomplete anesthetic protocol, particularly for a procedure requiring significant analgesia or muscle relaxation, is unacceptable. This demonstrates a disregard for the patient's comfort and surgical needs, potentially leading to intraoperative awareness or inadequate surgical conditions, and is a failure to uphold the veterinarian's duty of care. Professional reasoning. Professionals should approach anesthetic planning with a systematic, patient-centered methodology. This involves a comprehensive pre-anesthetic evaluation, careful selection of anesthetic agents and adjuncts based on patient factors and procedure type, and the implementation of robust monitoring protocols. Decision-making should be guided by a thorough understanding of anesthetic pharmacology, physiology, and the potential risks and benefits of different anesthetic strategies. Continuous reassessment of the patient's status and the anesthetic plan is paramount, allowing for timely adjustments to optimize safety and efficacy. Consulting with colleagues or relevant literature when faced with complex cases is also a hallmark of professional practice. Question 12. Strategic planning requires a veterinarian to meticulously interpret a peripheral blood smear from a canine patient presenting with lethargy and anorexia. The smear reveals a moderate number of neutrophils with hyposegmentation and the presence of a few toxic granulation. Considering the patient's clinical signs, which of the following approaches best reflects a comprehensive and diagnostically sound strategy for interpreting these findings? Option A. Conclude that the findings are likely artifacts due to poor smear preparation and proceed with treatment for a presumptive gastrointestinal upset. Option B. Document the hyposegmentation and toxic granulation. Correlate these findings with the patient's clinical signs and other diagnostic results, and consider differential diagnoses such as inflammatory or infectious processes or a potential artifact. Option C. Immediately diagnose Pelger-Head anomaly and initiate supportive care based on the hyposegmented neutrophils. Option D. Focus solely on the presence of toxic granulation, assuming a severe bacterial infection, and prescribe broad-spectrum antibiotics without further investigation. Correct answer is C. Immediately diagnose Pelger-Head anomaly and initiate supportive care based on the hyposegmented neutrophils. Explanation. Scenario analysis. This scenario is professionally challenging because interpreting blood smears requires a high degree of diagnostic acumen, especially when faced with subtle morphological changes or the presence of artifacts. Veterinarian must integrate these findings with the patient's clinical presentation and other diagnostic data to formulate an accurate diagnosis and treatment plan. Failure to do so can lead to misdiagnosis, delayed treatment, or inappropriate therapy, all of which can negatively impact patient outcomes and potentially lead to professional repercussions. Correct approach analysis. The correct approach involves a systematic and thorough evaluation of the blood smear, focusing on identifying and quantifying all cell types, noting any morphological abnormalities, and considering the clinical context. This aligns with the DABVP emphasis on evidence-based practice and the application of advanced veterinary knowledge. By meticulously examining the smear and correlating findings with the patient's history and other diagnostics, the veterinarian upholds their professional responsibility to provide the highest standard of care, as expected of a diplomate. This methodical approach minimizes the risk of overlooking critical findings and ensures that diagnostic conclusions are well supported. Incorrect approaches analysis. One incorrect approach involves making a definitive diagnosis based solely on the presence of a single, potentially artifactual, cellular change, without further investigation or consideration of other cellular populations. This violates the principle of comprehensive diagnostic evaluation and can lead to erroneous conclusions. Ethically, it represents a failure to exercise due diligence and could be considered a breach of professional competence if it results in patient harm. Another incorrect approach is to dismiss subtle but consistent morphological changes as insignificant without further investigation or consultation. This can lead to misdiagnoses of early-stage diseases or subclinical conditions. From a regulatory and ethical standpoint, this demonstrates a lack of thoroughness and a failure to meet the expected standard of care for a veterinary practitioner, particularly one seeking or holding DABVP status. A third incorrect approach is to rely solely on automated hematology analyzer results without performing a manual differential count and morphological assessment of the blood smear. While analyzers are valuable tools, they cannot always accurately identify all cell types or detect subtle morphological abnormalities that are crucial for diagnosis. This approach risks misinterpreting or missing critical information, which could lead to inappropriate treatment and a failure to meet professional standards. Professional reasoning. Professionals should approach blood smear interpretation with a structured methodology. This includes 1. Preparing a well-made smear, 2. Performing a low-power scan to assess overall distribution and identify any large abnormalities, 3. Conducting a high-power oil immersion examination to evaluate individual cell morphology, including nuclear and cytoplasmic characteristics, and 4. Quantifying cell types and identifying any abnormal or immature forms. Crucially, all findings must be integrated with the patient's signalment, clinical history, physical examination findings, and results from other diagnostic tests. When in doubt, consultation with a veterinary pathologist or a more experienced colleague is a sign of professional maturity and a commitment to patient welfare. Question 13. The performance metrics show a consistent increase in the incidence of refractory pruritus in canine patients presenting to the practice. A specific patient, a 7-year-old Labrador Retriever, has failed to respond to initial treatments for generalized pruritus, including a short course of corticosteroids and a standard antiparasitic regimen. Veterinarian is considering further therapeutic options and needs to select a drug that targets a specific inflammatory pathway involved in allergic skin disease. Which of the following drug classifications, when acting through its primary mechanism, would be most appropriate for addressing the underlying immunological component of this patient's pruritus? Option A, a phosphodiesterase PDE inhibitor. Option B, a Janus kinase JAK inhibitor. Option C, a histamine H1 receptor antagonist. Option D, a cyclooxygenase COX inhibitor. The correct answer is B, a Janus kinase JAK inhibitor. Explanation: scenario analysis. This scenario presents a common challenge in veterinary practice where a veterinarian must select an appropriate therapeutic agent for a patient with a complex presentation, requiring a nuanced understanding of drug classifications and mechanisms of action beyond simple indications. The challenge lies in balancing efficacy, safety, potential drug interaction, and patient-specific factors, all within the regulatory framework governing veterinary drug use in the United States. Accurate drug selection is paramount for patient welfare and adherence to federal and state veterinary practice acts. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's condition, considering the underlying pathophysiology and the specific pharmacological targets. This necessitates recalling or referencing the drug classifications and their precise mechanisms of action to identify agents that will effectively address the disease process while minimizing adverse effects and drug interactions. This aligns with the DABVP emphasis on advanced clinical knowledge and decision-making, ensuring that treatment is evidence-based and patient-centered, thereby upholding professional standards and regulatory compliance. Incorrect approach is analysis. One incorrect approach would be to select a drug based solely on its common use for a similar clinical sign, without understanding its mechanism of action or potential contraindications. This could lead to ineffective treatment, adverse drug reactions, or exacerbation of the underlying condition, violating the veterinarian's duty of care and potentially breaching veterinary practice acts that mandate competent and informed medical judgment. Another incorrect approach would be to choose a drug based on anecdotal evidence or personal preference, without consulting current scientific literature or established treatment guidelines. This disregards the importance of evidence-based medicine, a cornerstone of professional veterinary practice, and could result in suboptimal patient outcomes, failing to meet the standards of care expected of a DABVP Diplomate. A third incorrect approach would be to administer a drug without considering potential drug interactions with other medications the patient is currently receiving. This oversight can lead to synergistic or antagonistic effects, resulting in toxicity or treatment failure, and represents a failure to conduct a thorough patient assessment, which is a fundamental ethical and regulatory requirement. Professional reasoning. Professionals should employ a structured decision-making process that begins with a comprehensive patient assessment, including a thorough history, physical examination, and diagnostic workup. This is followed by formulating a differential diagnosis, and then identifying potential therapeutic targets. Next, the veterinarian should systematically review drug classes and their specific mechanisms of action relevant to the identified targets, considering factors such as efficacy, safety profile, pharmacokinetics, pharmacodynamics, potential drug interactions, and cost. Consulting reliable veterinary pharmacology resources and adhering to established treatment protocols are crucial steps. Finally, the chosen therapy should be monitored for efficacy and adverse effects, with adjustments made as necessary. This systematic approach ensures that treatment decisions are informed, evidence-based, and aligned with the highest standards of veterinary medical practice and regulatory compliance. Question 14. Assessment of a superficial skin lesion on a canine patient reveals a raised, erythematous area. The veterinarian decides to obtain a sample for cytological evaluation. Which of the following approaches to sample collection and slide preparation is most likely to yield a diagnostically accurate and interpretable sample, adhering to best veterinary practice for cytology? Option A. Collect a direct impression smear by pressing a clean glass slide firmly onto the lesion surface, then allow the slide to air dry before fixation. Option B. Obtain a fine needle aspirate of the lesion, then immediately roll the aspirate onto a clean glass slide and fix the slide with a fixative spray. Option C. Obtain a fine needle aspirate of the lesion, then spread the aspirate thinly on a clean glass slide using another slide, and fix the slide with a fixative spray. Option D. Gently scrape the surface of the lesion with a sterile scalpel blade, and immediately transfer the material to a clean glass slide, then fix the slide with a fixative spray. The correct answer is D. Gently scrape the surface of the lesion with a sterile scalpel blade and immediately transfer the material to a clean glass slide, then fix the slide with a fixative spray. Explanation: this scenario presents a professional challenge due to the inherent variability in sample quality and the potential for misinterpretation, which can directly impact patient diagnosis and treatment. The veterinarian must exercise careful judgment in selecting the most appropriate method for obtaining and preparing a cytology sample to ensure diagnostic accuracy, adhering to established veterinary practice standards. The correct approach represents best professional practice because it prioritizes obtaining a high-quality, representative sample that minimizes artifact and maximizes the chances of accurate interpretation. This aligns with the ethical obligation to provide competent veterinary care and the regulatory expectation of maintaining professional standards in diagnostic procedures. Utilizing appropriate collection techniques, such as direct impression smears or fine needle aspirates with proper technique, and meticulous slide preparation, including immediate fixation and careful spreading, are crucial for cellular preservation and visualization. This directly supports accurate cytological evaluation, which is a cornerstone of veterinary diagnostics. An incorrect approach involving delayed fixation of a direct impression smear is professionally unacceptable. This failure to fix the slide immediately allows for autolysis and distortion of cellular morphology, leading to potential misinterpretation of the cytological findings. This can result in incorrect diagnoses, inappropriate treatment plans, and ultimately compromised patient welfare, which violates the veterinarian's duty of care. Another incorrect approach, such as over-manipulating the sample during smear preparation, can cause cellular smearing and distortion, obscuring critical diagnostic features. This lack of technical proficiency in slide preparation can render the sample non-diagnostic or lead to erroneous conclusions, again impacting patient care and falling short of professional standards. Finally, an incorrect approach of relying solely on gross appearance without proper cytological preparation and evaluation is a significant professional failing. Cytology provides crucial cellular detail that cannot be discerned grossly. Omitting this step bypasses a fundamental diagnostic modality, leading to incomplete or inaccurate assessments and potentially missing critical diagnoses, which is a breach of professional responsibility. The professional reasoning process for similar situations should involve a systematic evaluation of the sample type, the suspected pathology, and the available resources. The veterinarian must consider the most appropriate collection method to obtain a representative sample, followed by meticulous preparation techniques to ensure optimal cellular preservation and visualization. This proactive approach to sample quality control is essential for accurate cytological interpretation and effective patient management. Question 15. Comparative studies suggest that while standard pharmacokinetic and pharmacodynamic principles guide initial drug selection and dosing in veterinary medicine, individual patient variability can significantly impact therapeutic outcomes. You are presented with a feline patient diagnosed with a severe bacterial infection requiring a broad-spectrum antibiotic. You have identified two antibiotic options with similar spectrums of activity, but one has a narrower therapeutic index and requires more frequent dosing to maintain plasma concentrations within the effective range, while the other has a wider therapeutic index but a longer half-life, potentially leading to accumulation in patients with compromised renal function. The owner is concerned about the cost of treatment and the frequency of administration. Which of the following approaches best reflects the application of pharmacokinetic and pharmacodynamic principles in this ethically complex scenario, prioritizing patient well-being and professional responsibility? Option A. Administer the antibiotic with the longer half-life at a reduced dose to mitigate the risk of accumulation, even if this means plasma concentrations may occasionally fall below the minimum inhibitory concentration, MIC, for some pathogens. Option B. Select the antibiotic with the wider therapeutic index, carefully monitoring renal function and adjusting the dose based on pharmacokinetic principles if any signs of accumulation are observed, while discussing the potential for dose adjustment with the owner to manage cost and administration frequency. Option C. Choose the antibiotic with the narrower therapeutic index due to its more predictable pharmacokinetic profile, assuming the owner can adhere to the strict dosing schedule to ensure therapeutic concentrations are consistently achieved. Option D. Prescribe the antibiotic with the narrower therapeutic index and rely on the owner's report of the cat's general well-being to gauge efficacy, without specific pharmacokinetic monitoring. The correct answer is B. Select the antibiotic with the wider therapeutic index, carefully monitoring renal function and adjusting the dose based on pharmacokinetic principles if any signs of accumulation are observed, while discussing the potential for dose adjustment with the owner to manage cost and administration frequency. Explanation: this scenario presents a professional challenge due to the inherent variability in patient response to medications, even when pharmacokinetic and pharmacodynamic principles are applied. The veterinarian must balance the scientific understanding of drug behavior with the practical realities of individual animal physiology, disease state, and potential owner compliance. The ethical imperative is to provide the best possible patient care while adhering to professional standards and regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient safety and efficacy through a systematic, evidence-based, and adaptable strategy. It acknowledges the limitations of generalized pharmacokinetic and pharmacodynamic data and emphasizes the need for individual patient monitoring and adjustment. This aligns with the DABVP commitment to advanced veterinary practice, which necessitates a thorough understanding and application of these principles in a clinical context, ensuring responsible drug use and optimal therapeutic outcomes. Adherence to established veterinary drug formularies and guidelines, as well as clear communication with the owner, are also critical components of this ethical and professional standard. An incorrect approach that relies solely on initial dosing, without considering patient response or potential for adverse effects, fails to uphold the principle of prudent drug use. This could lead to subtherapeutic outcomes or toxicity, violating the veterinarian's duty of care. Another incorrect approach that involves extrapolating data from unrelated species without rigorous justification or failing to document the rationale for drug selection and monitoring would be professionally unacceptable. Such actions demonstrate a lack of due diligence and could be construed as practicing outside the scope of established veterinary knowledge and regulatory expectations. Furthermore, neglecting to inform the owner about potential side effects or the rationale behind the chosen treatment plan constitutes a failure in client communication, which is a cornerstone of ethical veterinary practice. The professional decision-making process for similar situations should involve a thorough assessment of the patient's condition, a review of relevant pharmacokinetic and pharmacodynamic data for the chosen drug in the target species, consideration of potential drug interactions, and an evaluation of the owner's ability to administer medication and monitor the patient. This should be followed by the selection of an appropriate therapeutic agent, the establishment of a monitoring plan, and clear communication with the owner. The veterinarian must remain adaptable, prepared to adjust the treatment plan based on the patient's response and any observed adverse effects, always documenting all decisions and observations. Question 16. Strategic planning requires a veterinarian to interpret a complex clinical biochemistry panel for a critically ill canine patient, revealing significant elevations in liver enzymes, azotemia, and electrolyte imbalances. The owner is visibly distressed and expresses concern about the potential cost of further diagnostics and treatment. Considering the DABVP emphasis on advanced veterinary practice and client communication, which approach best balances diagnostic accuracy, patient welfare, and client engagement. Option A. Focus primarily on stabilizing the patient's immediate clinical signs, deferring a thorough explanation of the biochemical abnormalities and their implications until the patient is more stable to avoid overwhelming the owner. Option B. Immediately recommend a comprehensive panel of advanced diagnostic imaging and specialized consultations, emphasizing the urgency of the situation to justify the expense. Option C. Proceed with empirical treatment based on the most likely diagnosis suggested by the initial biochemistry results, without further extensive diagnostic investigation, to manage costs for the owner. Option D. Provide a detailed explanation of the clinical biochemistry findings, correlating them with specific organ dysfunction and electrolyte derangements, and then collaboratively discuss a phased diagnostic and therapeutic plan, starting with less invasive and more cost-effective options, while clearly outlining potential outcomes and limitations. Correct answer is B. Immediately recommend a comprehensive panel of advanced diagnostic imaging and specialized consultations, emphasizing the urgency of the situation to justify the expense. Explanation. This scenario is professionally challenging because it requires the veterinarian to balance the immediate needs of a critically ill patient with the long-term financial and ethical considerations for the client, all within the framework of veterinary practice regulations. The veterinarian must not only interpret complex clinical biochemistry data, but also communicate these findings and their implications effectively to a distressed owner. The core challenge lies in providing the best possible medical care while respecting the client's autonomy and financial limitations, which are often intertwined with treatment decisions. The correct approach represents best professional practice because it prioritizes a thorough diagnostic workup and transparent communication. By explaining the significance of the abnormal clinical biochemistry values in relation to organ function and electrolyte balance, the veterinarian empowers the client to make informed decisions. This aligns with ethical principles of client education and informed consent, which are implicitly supported by the standards of care expected of DABVP diplomates. Furthermore, offering a tiered approach to diagnostics and treatment, starting with less invasive and potentially less expensive options, demonstrates a commitment to client welfare and responsible resource management, a key aspect of professional veterinary practice. An incorrect approach that focuses solely on aggressive, potentially cost-prohibitive diagnostics without adequate client consultation fails to uphold the principle of client-centered care. This could lead to financial strain on the client and potentially unnecessary procedures, violating ethical considerations regarding responsible use of veterinary resources and client financial capacity. Another incorrect approach that involves making unilateral treatment decisions without fully involving the client in the diagnostic and therapeutic planning process undermines the client's autonomy and the collaborative nature of veterinary care. This can lead to misunderstandings, dissatisfaction, and potential ethical breaches related to informed consent. A third incorrect approach that downplays the significance of abnormal clinical biochemistry values or offers a superficial explanation risks misinforming the client and leading to suboptimal patient outcomes, which is contrary to the professional obligation to provide competent medical care. The professional reasoning process should involve a systematic approach. First, a comprehensive assessment of the patient's clinical signs and initial diagnostic findings, including a thorough review of the clinical biochemistry panel. Second, a clear and empathetic communication strategy with the client, explaining the implications of the biochemical abnormalities for organ function and electrolyte status in understandable terms. Third, a collaborative discussion of diagnostic and therapeutic options, considering the patient's prognosis, the client's financial constraints, and their personal values. Finally, a commitment to ongoing monitoring and reevaluation of the patient's condition and treatment plan. Question 17. To address the challenge of a canine patient presenting with increased serosanguinous discharge from a surgical incision 72 hours post-orthopedic surgery, accompanied by mild lethargy and a slight elevation in rectal temperature, which of the following diagnostic and therapeutic strategies represents the most appropriate initial course of action? Option A. Perform a thorough physical examination. Palpate the surgical site for signs of dehiscence or fluctuance. Obtain diagnostic imaging, e.g., radiographs or ultrasound, of the surgical site, and collect samples for cytology and culture if indicated, before initiating specific antimicrobial therapy. Option B. Schedule the patient for immediate surgical exploration and wound revision without further diagnostic workup. Option C. Advise the owner to monitor the incision closely for further changes and to return if the discharge worsens significantly. Option D. Immediately initiate broad-spectrum systemic antimicrobial therapy and advise the owner to continue strict rest. The correct answer is D. Immediately initiate broad-spectrum systemic antimicrobial therapy and advise the owner to continue strict rest. Explanation. Scenario analysis. This scenario presents a common yet critical post-operative challenge. a patient exhibiting signs of potential surgical site infection. The professional challenge lies in accurately diagnosing the cause of the symptoms, differentiating between a localized infection and a more systemic issue, and initiating appropriate treatment promptly. Delay or misdiagnosis can lead to significant patient morbidity, prolonged recovery, increased costs, and potential legal ramifications. The veterinarian must balance the need for immediate intervention with the importance of a thorough diagnostic workup, all while adhering to established veterinary standards of care and client communication protocols. Correct approach analysis. The correct approach emphasizes a systematic diagnostic process, starting with a thorough physical examination and palpation of the surgical site. This is followed by diagnostic imaging to assess the extent of any inflammation or fluid accumulation, and laboratory diagnostics to identify potential pathogens and assess systemic health. Prompt initiation of appropriate antimicrobial therapy based on diagnostic findings and susceptibility testing, if indicated, is crucial. This approach aligns with the DABVP emphasis on evidence-based medicine and the highest standards of patient care. It demonstrates a commitment to accurate diagnosis, appropriate treatment, and minimizing patient suffering, which are core ethical and professional responsibilities for a diplomate. Incorrect approaches analysis. One incorrect approach involves immediately escalating to broad-spectrum systemic antibiotics without a thorough physical examination or diagnostic imaging. This is a failure of due diligence and can lead to antibiotic resistance, masking of underlying issues, and unnecessary side effects for the patient. It bypasses the critical step of identifying the specific problem, which is a deviation from best professional practice and could be considered negligent if it leads to a worse outcome. Another incorrect approach is to simply advise the owner to monitor the situation without further investigation or intervention. This demonstrates a lack of proactive patient management and a failure to recognize the potential severity of post-operative complications. It shifts the burden of diagnosis and management onto the owner, which is ethically unacceptable and falls below the expected standard of care for a veterinary professional. This could be viewed as a failure to provide adequate veterinary services. A third incorrect approach is to perform a reoperation without a clear diagnostic indication. While reoperation may be necessary in some cases, it should be based on specific findings from diagnostic tests that point to a surgical complication requiring revision. Performing surgery without this evidence is an unnecessary risk to the patient, incurs additional costs, and may not address the root cause of the symptoms. This represents a failure to apply sound clinical judgment and could be seen as an overreach of diagnostic and therapeutic intervention. Professional reasoning. Professionals should employ a structured decision-making framework when faced with post-operative complications. This involves 1. Initial assessment. Thoroughly evaluate the patient's vital signs and overall condition. 2. Focused examination. Perform a detailed physical exam, paying close attention to the surgical site and surrounding tissues. 3. Diagnostic prioritization. Based on the initial assessment, determine the most appropriate diagnostic tests, e.g., imaging, blood work, cytology, to pinpoint the cause of the complication. 4. Treatment planning. Develop a treatment plan that is tailored to the specific diagnosis, considering efficacy, patient safety, and client communication. 5. Reevaluation. Continuously monitor the patient's response to treatment and adjust the plan as needed. This systematic approach ensures that patient care is evidence-based, ethical, and aligned with the highest professional standards expected of a DABVP diplomate. Question 18. Market research demonstrates that clients increasingly seek transparency and value in veterinary care, particularly when faced with complex medical situations. A 7-year-old Labrador Retriever presents with acute onset of lethargy, vomiting, and abdominal pain. Initial physical examination reveals moderate dehydration, pale mucous membranes, and a palpable abdominal discomfort. The owner expresses significant financial concerns, stating they have a strict budget for veterinary care. Considering the physiological presentation and the client's constraints, which of the following diagnostic and therapeutic approaches best balances patient welfare with client-centered care and responsible practice? Option A. Immediately recommend a full panel of advanced diagnostics, including CT scan, echocardiogram, and referral to a surgical specialist, regardless of the owner's stated financial limitations, to ensure no diagnostic stone is left unturned. Option B. Perform an exploratory laparotomy as the primary diagnostic and therapeutic intervention, assuming the abdominal pain is indicative of a surgical emergency, and inform the owner of the costs afterward. Option C. Initiate aggressive fluid therapy and pain management, followed by a phased diagnostic approach starting with basic blood work, CBC, chemistry panel, and urinalysis. Based on these results, consider abdominal ultrasound, and then potentially exploratory surgery if indicated, always discussing each step and its associated costs with the owner before proceeding. Option D. Provide symptomatic treatment with antiemetics and analgesics, and advise the owner to monitor the dog at home, deferring further diagnostics until the dog's condition either significantly improves or deteriorates to a critical point. The correct answer is C. Initiate aggressive fluid therapy and pain management, followed by a phased diagnostic approach starting with basic blood work, CBC, chemistry panel, and urinalysis. Based on these results, consider abdominal ultrasound and then potentially exploratory surgery if indicated, always discussing each step and its associated costs with the owner before proceeding. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the veterinarian to balance the immediate needs of a critically ill patient with the long-term financial and ethical considerations for the client. The veterinarian must accurately assess the physiological status of the patient, understand the potential benefits and risks of various diagnostic and therapeutic interventions, and communicate these complex issues effectively to the client. The challenge lies in providing the highest standard of care while respecting the client's autonomy and financial limitations, all within the framework of veterinary practice regulations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough physiological assessment and a phased diagnostic plan. This aligns with the DABVP emphasis on evidence-based medicine and the responsible application of veterinary knowledge. By first stabilizing the patient and then proceeding with diagnostics based on the initial findings and the client's stated goals, the veterinarian demonstrates a commitment to patient welfare and client-centered care. This approach minimizes unnecessary procedures, reduces financial burden on the client, and allows for informed decision-making at each step. It adheres to the ethical principles of beneficence and non-maleficence, ensuring that interventions are justified and beneficial. Incorrect approach is analysis. One incorrect approach involves immediately recommending extensive, high-cost diagnostic imaging and specialized consultations without a preliminary physiological assessment or discussion of the client's financial constraints. This fails to uphold the principle of prudent resource allocation and can lead to unnecessary financial strain on the client, potentially compromising their ability to afford essential care. It also risks performing diagnostics that may not be relevant to the patient's immediate physiological state. Another incorrect approach is to dismiss the client's financial concerns and proceed with aggressive, potentially life-saving interventions without exploring more conservative or cost-effective options. This disregards the client's autonomy and can create an adversarial relationship, undermining trust and potentially leading to the abandonment of care. It also fails to consider the ethical implications of imposing significant financial burdens without clear justification or client consent. A third incorrect approach is to offer a best-guess diagnosis and treatment plan without adequate physiological assessment or diagnostic investigation, especially in a complex case. This deviates from the standard of care expected of a diplomate and risks misdiagnosis, delayed treatment, or inappropriate therapy, all of which can negatively impact patient outcomes and expose the veterinarian to professional liability. Professional reasoning. Professionals should approach such situations by first performing a comprehensive physical examination and initial physiological assessment to stabilize the patient. This should be followed by an open and honest discussion with the client regarding the patient's prognosis, the range of diagnostic and therapeutic options, their associated risks and benefits, and the estimated costs. The veterinarian should then collaboratively develop a treatment plan that aligns with the client's goals and financial capabilities, while always prioritizing the patient's well-being. This iterative process of assessment, communication, and planning ensures ethical and effective veterinary care. Question 19. Process analysis reveals a veterinarian is presented with a 6-month-old Labrador Retriever exhibiting intermittent diarrhea and poor coat quality. The owner reports the puppy has had access to a fenced yard and has not traveled recently. The veterinarian suspects an intestinal parasitic infection. Which of the following diagnostic approaches best aligns with best professional practice for identifying common intestinal parasites in this patient. Option A. Prescribe a broad-spectrum anthelmintic based on the clinical signs of diarrhea and poor coat quality. Option B. Administer a fecal antigen test for common intestinal parasites without performing a microscopic examination. Option C. Rely solely on the owner's description of the puppy's symptoms to diagnose the parasitic infection. Option D. Perform a fecal flotation and direct smear examination, followed by accurate identification of parasite ova or larvae based on their morphology. The correct answer is D. Perform a fecal flotation and direct smear examination, followed by accurate identification of parasite ova or larvae based on their morphology. Explanation. Scenario analysis. This scenario is professionally challenging because accurate identification of intestinal parasites in a canine patient is critical for effective treatment and prevention of zoonotic transmission. Misidentification can lead to inappropriate drug selection, treatment failure, and potential public health risks. The veterinarian must rely on their diagnostic skills and understanding of parasite morphology and life cycles to make informed decisions. Correct approach analysis. The correct approach involves microscopic examination of fecal samples using appropriate diagnostic techniques, such as direct smear and flotation, followed by accurate identification of parasite ova or larvae based on their characteristic morphology. This aligns with best professional practice as outlined by veterinary parasitology guidelines and the DABVP emphasis on evidence-based diagnostics. Accurate identification ensures targeted therapy, minimizing drug resistance and adverse effects, and fulfilling the veterinarian's ethical obligation to provide competent care and protect public health. Incorrect approach is analysis. One incorrect approach would be to rely solely on clinical signs without diagnostic confirmation. This is ethically problematic as it deviates from the standard of care, potentially leading to delayed or incorrect treatment, and fails to meet the professional obligation for accurate diagnosis. It also ignores the potential for asymptomatic carriers or concurrent infections. Another incorrect approach would be to prescribe a broad-spectrum dewormer based on a presumptive diagnosis without any fecal examination. This is a failure of due diligence and professional responsibility. It contributes to the development of anthelmintic resistance, is economically inefficient for the client, and does not address the specific parasitic burden, potentially leading to treatment failure. This approach bypasses essential diagnostic steps required for responsible veterinary practice. A third incorrect approach would be to misinterpret the morphology of a parasite ovum, leading to an incorrect identification. This highlights a deficiency in diagnostic skill or knowledge, which is a direct failure to meet the competency standards expected of a veterinarian, particularly one seeking DABVP certification. Such an error can result in prescribing the wrong medication, leading to treatment failure and potential harm to the animal and continued environmental contamination. Professional reasoning. Professionals should approach diagnostic challenges by systematically applying established protocols. This involves gathering a thorough history, performing a complete physical examination, and utilizing appropriate diagnostic tools. In parasitology, this means performing fecal examinations with proper technique and accurately interpreting the findings. When faced with uncertainty, consulting diagnostic parasitology resources, experienced colleagues, or diagnostic laboratories is a hallmark of professional integrity and a commitment to providing the highest standard of care. The decision-making process should prioritize patient welfare, client communication, and adherence to scientific evidence and ethical guidelines. Question 20. The risk matrix shows a moderate likelihood of adverse drug reactions when administering a new therapeutic agent to a critically ill feline patient. Given this, which of the following approaches to dosage calculation and administration route selection is most aligned with best professional practice for a DABVP Diplomate? Option A. Recalculate the dosage based on the patient's current body weight and critically assess the most appropriate route of administration by consulting the drug's approved labeling and relevant veterinary literature, documenting the rationale. Option B. Administer the drug as standard dose for adult cats, as the patient's critical illness is unlikely to significantly alter drug metabolism or distribution. Option C. Administer the drug via the quickest and most convenient route for the veterinary team, regardless of the drug's pharmacokinetic profile or the patient's condition. Option D. Utilize the dosage previously administered to a similar-sized feline patient in the practice's records, assuming the drug's effects will be comparable. The correct answer is A. Recalculate the dosage based on the patient's current body weight and critically assess the most appropriate route of administration by consulting the drug's approved labeling and relevant veterinary literature, documenting the rationale. Explanation. This scenario presents a professional challenge due to the inherent variability in patient response to medications and the critical need for accurate dosage and administration to ensure efficacy and patient safety, all within the strict regulatory framework governing veterinary practice in the United States. The DABVP certification emphasizes a high standard of clinical competence, which includes a thorough understanding of pharmacokinetics and pharmacodynamics as applied to dosage calculations and administration routes. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based method for determining and administering medication. This involves not only calculating the dose based on patient factors, but also critically evaluating the most appropriate route of administration for the specific drug and clinical situation, considering absorption rates, potential for irritation, and patient tolerance. Adherence to established veterinary drug formularies, manufacturer guidelines, and peer-reviewed literature is paramount, aligning with the ethical obligation to provide competent care and the legal requirement to practice within accepted veterinary standards. This approach minimizes the risk of under- or overdosing, adverse drug reactions, and treatment failure, thereby upholding patient welfare and professional integrity. An incorrect approach that involves relying solely on a previously used dose for a similar-sized patient without re-evaluating current patient parameters, e.g., weight, hydration status, organ function, represents a failure to adhere to the principle of individualized patient care. This can lead to significant dosing errors, potentially causing toxicity or subtherapeutic effects, which violates the ethical duty to provide competent care and could be considered a deviation from accepted veterinary practice. Another incorrect approach, such as choosing an administration route based on personal preference or ease of administration without considering the drug's properties and the patient's condition, is also professionally unacceptable. For instance, administering a drug intravenously that is intended for oral absorption might lead to unpredictable pharmacokinetics, increased risk of adverse effects, or failure to achieve therapeutic concentrations. This demonstrates a lack of critical thinking and a disregard for evidence-based medicine, potentially compromising patient safety and falling short of the standards expected of a DABVP Diplomate. Finally, an approach that neglects to document the dosage calculation, administration route, and rationale in the patient's medical record is a significant regulatory and ethical failure. Proper documentation is a legal requirement and a cornerstone of professional practice, allowing for continuity of care, peer review, and accountability. Failure to document adequately hinders effective communication among veterinary team members and can impede future treatment decisions, potentially leading to medical errors and a breach of professional responsibility. The professional decision-making process for similar situations should involve a comprehensive assessment of the patient, including species, breed, age, weight, physiological status, and concurrent diseases. This should be followed by a thorough review of the drug's pharmacology, including its indications, contraindications, recommended dosages, and available administration routes. Consulting reliable veterinary drug references and considering the specific clinical context are essential steps. The chosen dosage and route should then be critically evaluated for safety and efficacy, with clear documentation of the entire process.